If your doctor has used the words bone on bone, if they've mentioned the possibility of knee replacement surgery, if they've told you there's nothing left to do except cut your knee open and put in metal and plastic, I need you to stop and listen. Because what I'm about to show you is something your great-grandmother knew that modern medicine forgot. It's called gelatin. Plain, simple, cheap gelatin. And it might be the difference between surgery and walking pain-free again. Before we go any further, I need to be very clear. I am not a doctor, and nothing in this video is medical advice. If you have severe knee pain, swelling, or your doctor has recommended surgery, please do not ignore that advice without consulting them first. What I'm sharing is educational information about nutrition and joint health. Now, let me tell you why your knees are breaking down. And it's not just because you're getting older, it's because of what you're not eating. See, your knee cartilage is like a sponge, a thick, slippery, bouncy sponge that sits between your bones and absorbs shock every time you take a step. But here's the problem. That sponge is made of something very specific. It's made of collagen. And collagen is built from amino acids called glycine and proline. Your great-great-grandparents ate the whole animal. They made bone broth from chicken feet. They ate the skin on their meat. They saved the drippings and used them in cooking. They weren't trying to be healthy, they were just being practical. But in doing so, they were feeding their bodies massive amounts of glycine and proline. Then something changed. We decided we only wanted the pretty parts of the animal. Boneless, skinless chicken breast. Lean steak with all the fat trimmed off. We threw away the bones, the skin, the tendons, the cartilage. All the parts that are rich in the building blocks your knees desperately need. And now we have an epidemic of joint problems. Not because we're living longer, but because we're not eating the sticky, jiggly parts that build cartilage. So what is gelatin? Gelatin is what you get when you take those parts we've been throwing away through skin, the bones, the connective tissue, and you cook them down. You're literally extracting the collagen. You're turning solid cartilage into a form your body can actually use. Gelatin is hydrolyzed collagen. That means the protein chains have been broken down into smaller pieces that your digestive system can absorb. When you eat gelatin, you're giving your body the exact amino acids it needs to rebuild cartilage. It's like giving a construction crew the right materials. You can't build a brick house if all you have is wood. And you can't build cartilage if you're not eating glycine and proline. Here's how it works in your body. When you consume gelatin, your digestive system breaks it down into individual amino acids. Those amino acids travel through your bloodstream to your joints. Your body recognizes them and says, "Oh, we can use these to repair cartilage." Then it starts building 3 strands of amino acids twist together to form a collagen helix. Multiple helices weave together to create a strong, flexible network. That network traps water like a sponge, creating the cushion between your bones. But here's the crucial part that most people miss. You cannot build collagen with gelatin alone. You absolutely must have vitamin C. Vitamin C is the catalyst. It's what allows your body to actually form those collagen bonds. Without it, the amino acids just float around and eventually get used for something else. This is why the protocol I'm about to share with you always includes lemon juice. Your great-grandmother might have made lemon jello without knowing the science, but she knew it worked. The lemon provides vitamin C, the gelatin provides glycine and proline. Together, they give your body everything it needs to rebuild the cushion in your knees. Now, there are fancy collagen supplements out there that cost $40 or $50 a month, and they work. But gelatin from the grocery store, the plain unflavored kind that costs $4 for a month's supply, works just as well, because chemically they're almost identical. The only difference is that collagen peptides are broken down into even smaller pieces. But your stomach acid breaks gelatin down to that same size anyway. So you're paying 10 times more for something your body does naturally. Let me tell you about Martha. She's 75 years old, lives in Pennsylvania. 3 years ago, she started having trouble with her right knee. At first, it was just stiffness in the morning. Then it became pain when she walked too long. Then she couldn't kneel down to garden anymore. Then she couldn't walk downstairs without holding the railing with both hands and going one step at a time. Her doctor ordered X-ray. The words he used were significant cartilage loss and bone-on-bone contact in the medial compartment. He told her that eventually she would need a knee replacement. He said they could try injections first, but that those were temporary. Martha was terrified. She'd heard stories from friends about knee replacement surgery, the pain, the months of physical therapy, the risk of infection, the fact that artificial knees only last 15 to 20 years, meaning she might need a second surgery in her 90s. Martha's daughter is a registered nurse. She'd been reading research about collagen and joint health. She told her mother about gelatin. Martha thought it sounded too simple. How could something that costs $4 fix what her doctor said needed surgery? But she figured she had nothing to lose. She bought plain beef gelatin from the grocery store. Every single morning, she mixed 1 tablespoon of gelatin powder into 4 ounces of hot water, stirred until it dissolved, added the juice of half a lemon, and drank it. She did this religiously, every single day. For the first 3 weeks, nothing happened. She kept doing it anyway. In week 4, she noticed something. The morning stiffness wasn't quite as bad. She could bend her knee a little further before it hurt. By week 8, she realized she'd walk down to her mailbox without thinking about it, without planning her steps, without bracing herself for pain. By 3 months, Martha called her orthopedic surgeon's office. She told them she wanted to cancel her surgery consultation. The receptionist asked if she wanted to reschedule. Martha said, "No, I don't think I need it anymore." Her doctor asked her to come in for a follow-up. He examined her knee. He had her walk, squat down, and climb stairs. He looked at her and said, "I don't know what you're doing, but keep doing it. You still have cartilage loss on the X-ray, but you're moving like someone 10 years younger." Martha told him about the gelatin. He shrugged and said, "Well, it's not hurting you, and you're clearly better." Now, Martha is not pain-free. She still has some discomfort if she overdoes it, but she's gardening again. She's walking her dog. She's playing on the floor with her great-grandchildren, and she's not getting her knee cut open. Let me show you why this works with a simple demonstration. Imagine 2 sponges. The first sponge is bone dry. It's been sitting in the sun for weeks. When you press on it, it cracks. It's rigid. It's brittle. There's no cushion left. That's your cartilage when you're not eating glycine and proline. It dries out. It becomes fragile. Bone starts grinding on bone. Now imagine a second sponge that's soaking wet. When you press on it, it compresses smoothly. When you release it, it springs back. It's flexible. It absorbs shock. That's your cartilage when you give your body the building blocks it needs. Gelatin provides the structure. Vitamin C helps build it. And water gets trapped inside, creating that cushion. You're not regrowing cartilage overnight. That's not possible. But you are giving your body the tools to repair and maintain what's still there, to slow down the breakdown, to rebuild the edges. So how do you actually do this? You have several options. Option 1, the morning protocol, which is what Martha used. Mix 1 tablespoon of unflavored beef gelatin powder into 4 ounces of hot water or hot tea. Stir until completely dissolved. Add the juice of half a fresh lemon. Drink it on an empty stomach, first thing in the morning. Wait 20 minutes before eating breakfast. Option 2, throughout the day. Add 1 teaspoon of gelatin powder to your morning coffee, afternoon tea, or evening soup. Do this 3 times a day for a total of 1 tablespoon. Add vitamin C separately, either through a supplement or by eating citrus fruit, bell peppers, or strawberries with each dose. Option 3, make your own healing jello. Dissolve 2 tablespoons of gelatin in 1 cup of hot water. Add the juice of 1 whole lemon. Add a little raw honey if you want sweetness. Pour into small cups and refrigerate. Eat 1 cup per day. Here's what you need to know about timing and expectations. Gelatin works best on an empty stomach. If you take it with a large meal, especially one high in other proteins, your body might use those amino acids for general purposes instead of specifically for cartilage repair. Take it first thing in the morning, or at least 2 hours after eating. Do not expect miracles in 1 week. Cartilage repair is slow. For some people, like Martha, noticeable improvement comes around week 4. For others, it takes 8 to 12 weeks. You must be consistent. Missing a day here and there is fine, but you can't take it once a week and expect results. This is not a pharmaceutical drug. It's nutrition. You're feeding your body the raw materials it needs. The results are cumulative. And here's something important. Gelatin is not just for your knees. People report improvements in back pain, hip pain, shoulder pain, even jaw pain, because all of those joints have cartilage. All of that cartilage needs glycine and proline. Now I need to talk about when gelatin is not enough. If you have severe, sudden knee swelling that came on in a day or two, that could be an infection or gout, and you need to see a doctor immediately. If your knee is red, hot to the touch, and you have a fever, that's a medical emergency. If you've had a fall or injury, and now you cannot put any weight on your leg, you may have a fracture or torn ligament. Gelatin will not fix that. If you've been using gelatin consistently for 3 months and you have gotten worse, not better, you need imaging and a proper diagnosis. Gelatin supports cartilage health. It does not cure infections, fractures, torn meniscus, or advanced arthritis where there is truly no cartilage left. It is a nutritional intervention for people who still have some cartilage remaining. But it's wearing down. Always work with your doctor. Get X-rays or MRs if needed. And if surgery is truly necessary, don't avoid it out of fear. But if you're in that gray zone where surgery has been mentioned but not urgently required, gelatin might be worth trying first. Here's what I want you to remember. Your body wants to heal. It wants to repair. It wants to build cartilage. But it cannot build something from nothing. If you're not giving it glycine and proline, it's like asking a construction crew to build a house without any lumber. Modern medicine is incredible for emergencies, for infections, for acute injuries. But for chronic wear and tear, for slow cartilage loss, for the kind of joint pain that creeps up over years, sometimes the answer isn't more advanced. Sometimes it's simpler. Your great-grandmother made bone broth because it was economical. She made jello because it was easy. She didn't know the words glycine or proline or collagen synthesis, but her knees worked, and she never needed surgery. You don't have to let them cut your knees until you've tried feeding your cartilage. For dollars, 1 tablespoon a day. 3 months, that's all Martha needed. Maybe that's all you need too. Thank you for watching the Senior Health Hub. Take care of your joints and keep moving.